Hey good people, Sammy Ashe here, Executive Director of the Ashe Academy and your host of our Inspire, Uplift, Engage podcast. It's officially time for our Mentors and Mimosas Gala season. October 16th, 2021 will be at the Chester, Washington Golf Course in Los Angeles, California. There are numerous opportunities for sponsorships, vendor booth space, and so much more. We're so excited to award our Ashe Scholars in pursuit of the arts and STEM, whether four-year schools, trade school, and conservatories. Plus, we're bringing back that Community Impact Award for those students making a difference in the community. Once again, be sure to save the date, October 16th, 2021, 10 a.m. to 2 p.m. We're brunching and honoring students and professionals. Can't forget our Humanitarian Award and Benevolence Award, too. Grab your VIP tickets on Early Bird while supplies last. Now, let's get started with the show. Welcome back, everyone, to another episode of the Ashe Academy's Inspire, Uplift, Engage podcast. I am Sammy Ashe, and today we're joined by Dr. Ryan Jean-Baptiste, who is a dual-boarded physician specializing in diagnostic and interventional radiology. Welcome. Thank you so much for joining us.
No, thank you for having me. I appreciate it.
Absolutely. Now, this is part of a Modern Vascular takeover of the podcast. Everyone knows that I work with Modern Vascular, and I've found a moment to, collaborate with some of the physicians that are there. So we are taking this moment for September, which is Pid Awareness Month, or Peripheral Artery or Arterial Disease Awareness Month, to make sure that we are spreading that awareness and getting all the information out to people who may or may not know about it. So more on that later, but we really want to go to the very beginning for you, Dr. Jean-Baptiste. Why did you decide to become a physician and go into the specialties you chose?
Well, so, most people will say that the vast majority of the things that happen to them are happenstance, right? And, very critical decisions at certain points push you one way or the other. And, I can't say that it's any different for me, but the reality of the situation is that when I started out as a kid, I said I always wanted to be a physician, right? And as I got older, I found out what that actually meant, right? But it was always a direction I was pointed towards, but I didn't really understand what it meant. It just sounded like when I was, 6 or 7, something good to come out of my mouth. But it was always in the back of my mind. And then actually, to be 100% honest with you, and this might not be the most politically correct answer, but it's, I'm a firm believer in people become what they can see, right? And so I did not have any physicians in my family. I had, aunts being, West Indian immigrant, Haitian background. Like I had aunts and cousins in nursing, but no physicians that I knew of in my family. Right. And then it wasn't until 1984 when honestly the Cosby Show came on, right, that becoming a physician became a reality for me because, having grown up in Brooklyn, I knew those blocks that he was living on, when they do those pre-shots, right? My mother had a friend who lived in Fort Greene. Those are the same brownstones that I had gone past as a kid, right? So the concept of him being a physician who lived in Brooklyn, right, put the idea in my mind, in my head that, this is something that's possible for me to do, right? And, and because of that, right, again, it was still always like this thing in the back of my mind, but I didn't necessarily know how to get there, right? But it became more real when that came around. And I always liked science and I always like, asking questions and things like that, but I wasn't the greatest student when I started out, right? I actually was, honestly, in 3rd grade, I was in remedial classes, right? And so, it's not where you start, it's where you finish, right? And when I made that switch, honestly, it was probably around 6th or 7th grade when I decided to say, okay, I'm going to try to become a better student, right? And that, for me, took the form of just applying myself and working harder, right, than the people I saw around me, right? And so I wasn't the most gifted person, right? But nobody was going to outwork me, right? If, people were going to wake up at 2 o'clock in the morning to study, not that I was doing that at 6, but it wound up being the case in college, right? I was going to wake up at 1,
Okay.
And so that became my, calling card. Nobody was going to outwork me, right? Because that's the one thing that you can control is how much effort you put into anything, right? And so, gradually I became a better student. By the time I was in 8th grade, I was, an okay student. And when I got into high school, I really, really applied myself. And then a lot of things from an academic standpoint sort of clicked for me, right? And I figured out, unfortunately, it took me a long time to figure out what's the best way for me to study, right? And once I figured that out, then, I took off. I went to an all-boys Catholic high school in New York called Zavarian, which gave me a good foundation. And honestly, I think for me personally, because it was during that puberty years when, your mind can sort of wander in some ways, right? Being in that environment for me personally was good because there was nothing else for me to do while I was at school but concentrate on school. And so that gave me the opportunity to apply myself and do very well. And, also my older brother had already, he was like 7 years ahead of me, and he had already gone to Harvard University as an undergrad. And so the concept of going to an Ivy League school was also, again, people become what they see, right? Before he did that, it didn't even cross my mind that this was possible, but he did. And then it crossed my mind, hey, I don't want him to beat me, so I have to, apply myself and get into just as good a school as he did. So then I applied to and got into Yale in New Haven, Connecticut, which for me was the perfect place because it allowed me to come home whenever I wanted to, right? Because it was like a 2-hour train ride from my house. And so I spent 4 years in undergraduate there, another 4 years in medical school. But I want to sort of circle back to my undergrad. When I got there, right, I had no idea that you even need to take an MCAT to get into med school. Nobody told me. Again, these are things that, in some families and some circles, these are things that are abundantly clear for you by the time you're 12 or 13. But nobody laid this path out for me. I had to kind of figure it out on my own. Right. And so then I understood that there was a test that I had to take. So then, and I didn't even know what classes I was supposed to take. I just thought you were supposed to be a science major. That's it. Right. Nobody, then people told me what I needed to do, but it wasn't like I went to Yale and I knew I needed to take organic chemistry and, physics and study for an MCAT in my junior year of college. Like when I was a freshman, I didn't know any of that stuff. Again, people shepherded me through that. And, this is going to get into one of the questions potentially you might ask later, but there were a lot of very good mentors I had. And had I not had those, right, I don't know where I would have gone awry. I would have wound up because they helped me and they supported me. Because sometimes it's not necessarily pointing somebody in the right direction, but in the darkest moments of every journey, right, you just need somebody to tell you can do it, right? It's been done before and you can do it, right? And you need to listen, but you also need that person to tell you that. And so I spent 4 years at an undergrad in Connecticut, and then I decided I wanted to stay, in large part because I liked community service and giving back, right? And so I had a really excellent. We had this program called Freshman Counselors, right, who sort of help freshmen through, and it was like 2 sets of freshman counselors. So there's your regular freshman counselor you get from your dorm, but then Yale added an additional set of freshman counselors for people of color at the school called ethnic counselors. And I actually had a really good relationship with my ethnic counselor, who was this guy named Janique Bonton, he produces movie scores now. But, he was a huge influence on me because he helped me a lot through that first year, just trying to orient myself in that environment. Again, because I had grown up in Brooklyn, I'd gone to school in Bay Ridge, right? But I got on the train and came home every day, right? And this was the first time I had lived around a lot of people who didn't look like me, honestly, right? And that became, in some ways, a stressor, right? It wasn't a huge stressor, but it was just different, right? People, and that's part of college, but, that was something I had to sort of work my way through to begin with. And so I circled back to that, and he was a huge influence on me. So I decided to become an ethnic counselor my senior year, right? And I applied for that counselor position, and I became one. And part of the reason why I stayed at Yale to do my medical school was so that I could actually see my freshmen graduate, right? And so that was very important to me because they were a very, they were like my first set of kids almost. I have 2 children now, but they were like my first set of kids. And, their development and how they changed from when they were freshmen to when they were seniors was amazing to me. And, I just really wanted to be around for that. And then, so I stayed there for 5 years. I took a year off to do research, which, you have to do in order to get out of there. You got to do a research project. And then I went to Dorchester, Massachusetts for my intern year, because when you apply in radiology, you have to do everybody has to do a medical internship for a year. And then you can either choose to do medicine or surgery or a transitional year, which is a combination of both. So I spent 1 year in Dorchester doing internal medicine. And I spent 4 years back in New York at home, at Lenox Hill Hospital doing my diagnostic radiology residency. And so when I was in medical school, right, I didn't necessarily, again, know what I wanted to do. I just knew I wanted to be a doctor, and I didn't really know what that meant. And so because the only doctor I knew was Dr. Cliff Huxtable, I thought I wanted to be an obstetrician and gynecologist, right? But then I decided, hey, all children want to be born at 2:00 in the morning. And I don't want to do this for the rest of my life and get up at 2:00 in the morning every time somebody wants to get born. So maybe I need to find something else to do. And so I was like, maybe, become a nephrologist, because that deals with a lot of people of color. Because again, everything I did was trying to give back, right? I wanted to become an obstetrician gynecologist because I felt like the rates of maternal mortality were ridiculously high in the African-American community, right? And I wanted to be a part of that, right? Or trying to change that trend. I wanted to become a nephrologist potentially because, diabetes and renal failure runs rampant in our community, right? And so I wanted to help out. And, I had my grandmother was on dialysis and that sort of thing, right? And so those were things that I wanted to do. I wanted to help out, right? But, those areas didn't necessarily suit me, right? And so I was still trying to figure out exactly what I wanted to do. And I was like, I like working with my hands. I'm good with my hands. And so, maybe I'll become a surgeon, right? And then general surgery didn't, really interest me. Orthopedics, maybe, there's a lot of interesting stuff, and, it's around a lot of athletes, and I was an ex-football player. So I thought that might work for me, but it didn't really fit, right? And then I did a vascular surgery, like, rotation. And I was like, again, a lot of fortuitous things. The fellow who was my fellow when I was a third year medical student rotating through there was a person of color, right? And was a good support for me. So it was like, hey, I can do this because I see somebody already in front of me doing it, right? And he gave me a pivotal piece of advice, which is like, at that time, most of vascular surgery was open surgery, right? Bypasses, and, you did aortic aneurysm repairs open, right? But he was like, this is going to change, right? There's going to be a lot of minimally invasive stuff, wires and catheters, and you should learn those skills, especially if you're thinking about applying for a vascular surgery fellowship. So he told me, hey, why don't you do a month in interventional radiology and diagnostic radiology? So I went down there and I realized, hey, I like this stuff. I can do the diagnostic radiology because basically a lot of it's anatomy and understanding that. And, I really thought that, all these endovascular techniques that I would learn, they'd be better. I would learn them better if I was doing primarily just that. So that's how I wound up applying in interventional diagnostic radiology. But I did a diagnostic radiology residency in order for me to be able to do an interventional radiology residency. And my primary focus during my interventional radiology residency, the reason why I chose to go to University of Michigan, for instance, was because I got an opportunity to spend a month on vascular surgery with vascular surgeons, understanding how they think about vascular disease and working up those patients. And, and there was no antagonistic relationship between interventional radiology and vascular surgery there, right? And that was something that was very key to me, because I feel like, as this whole PAD space evolves, right, there's going to be less and less these artificial silos created by your training, right? And it's just going to be like, who's a vascular medicine specialist and who wants to do this work and help these patients? And it doesn't really make a difference where you were, what space you were trained in, right? The only thing that's going to matter is whether or not you want to do the work and whether or not you care about the patients in order to do the work, right? And I think we're getting to that point because, I learned a lot from cardiologists. I learned a lot from vascular surgeons. One of my closest friends here right now is a vascular surgeon, right? And I collaborate with him on cases all the time. We bounce stuff off each other. And that's, I think, how you're going to be able to push this space forward and get a cadre of individuals who actually want to do the work and care about these patients and care about the disease process, and will push the envelope towards treating these patients and, saving as many limbs as possible. So that's kind of my story, at least from an academic standpoint.
That's beautiful. And, it's super important hearing from doctors that they really care about patients, because anyone who's outside of the medical field who's like possibly considering it, it's like dollar signs at the first thing. And I'm like, oh, that can't be the top.
No, let me explain something to you, right? Listen, when I was applying to medical school, that was the dumbest thing you could have possibly done, because it was the .com bubble, and everybody in my class was either going into investment banking or going out to California and joining some startup, right? And if I really wanted to be rich, right, if that was my goal, right, I would have gone in investment banking, because they were recruiting like nobody's business. Yeah. It didn't turn out so well in 2008, but before that, it was a good job. And there was lots of times when I was trundling through the snow to and from my residency, like, shoot, I know half of my class, my undergrad class, is sitting somewhere like making huge deals for millions of dollars, and I'm working for whatever, like not that great amount of money compared to the amount of education I had, right? Yeah. But it was a passion, and it is a passion. It still is. And I don't do it because of money. I just honestly do it because I like the cases. I like the patient population. I like helping patients. And I feel like of the things that I do as a diagnostic radiologist, as an interventional radiologist, this is probably the biggest. There are some frustrations sometimes, but it's the one area where you can clearly link, improved outcomes to revascularizing people's lower extremities and saving limbs.
Absolutely. So when you were in your programs and you're finding out how many years you have to go through to finally get to, I guess, and the goalposts, and then it keeps on moving because, you got to do, it's like, 4 years and then 4 more years and then residency. So like, how do you continue going on after you're like, this is essentially 10 plus years out of my life that I have to commit to finally step into this profession. So just for anyone who's looking to become a doctor, which is a huge umbrella, there's so many specialties that you can get into, but like, how do we help those students who are considering it, like, just stay the course, like you'll get there. It might be 10 years, but like, what helped you get through?
Well, a couple of things. Like I said, I have to give a huge shout out to, rest in peace, my mentor. And she was a mentor to just about every Black undergrad science major at Yale from 1995 on, right, until she left. It was Dr. Ayanna Black, who created this program that, again, exposed us to things that we might not have necessarily been exposed to, right? At least me personally, because I didn't go to like a specialized high school in New York, like, Stuyvesant and stuff like that. So I didn't have, the opportunity to be around research and that sort of thing and understand that, those are parts of building a resume, right? And so had I not, she gave me the opportunity a lot of people, the opportunity to do research and, expose you to STEM, all areas of it. Mechanical engineering didn't make a difference what it was. She had a connection to help you get into a lab to do something. And she was always one of my biggest cheerleaders. My mother was a huge, big cheerleader, right? And those are the people you need, because, you know, you have to have a vision, right? And once you get the vision, right, there's always a light at the end of the tunnel, and there's going to be dark spots. And really, the thing that gives you the opportunity to continue on really is having cheerleaders in your background, because, you know, there's not a lot of support for people who look like me and you, right, in this space, right? And when you walk into a lab, sometimes people don't assume that you know what you're doing, right? And so those can be irritating things and grate on you, and that can try and push you out of the space, right? And you have to be, people talk about strength, right? And there is some level of internal strength, but there's always somebody either gently or forcibly putting a boot to behind to make sure that you stay there and do what you're supposed to do, and move forward, and telling you can do this, right? Because if you don't have somebody in your corner telling you can do this, is very hard. Because everybody, I don't care who you are, has bad days, bad weeks, bad months, bad whatever, right? And there's points in that everybody wants to quit. I don't care who you are, right? There was lots of times when I was a resident, I was like, man, why am I doing this when I know I could go I could go to Midtown Manhattan, like downtown, and make tons of money, right? Just because I know how to do math, right? Well, why am I putting myself through? But the reality situation is you have to have those cheerleaders. You don't have them, right? And, you know, fortunately enough, there's more and more people who, you know, look like us getting into the space, and not as many as it should, but there's more than there was when I was coming through, right? And those people provide an opportunity, a beacon, a light post for people to continue to push themselves forward. But you have to have cheerleaders. It just doesn't work without them.
Absolutely, absolutely. So it's
and programs like this, you know, and opportunities to meet people who can become cheerleaders.
Absolutely. Very much so. The advocacy part has been the most impactful for me. Just those thank yous for existing, like being in a space to mentor. Those thank yous touch me the most, because it's like, okay, like I co-found this with my sisters, but like you just seeing me, and that's like, okay, all right, I'm okay. Like, even if we didn't have an in-depth conversation with one of the students, and it was
Right.
just like, I just saw you, I felt a lot better about what I'm pursuing because you were there. It's
Right.
like, that's why I'm here. That's exactly why I'm here. So let's talk about those mentors and those teachers and professors along the way. You did mention and shout them out, but I'm very curious as to how those relationships got started. Something interesting we've been discussing lately is between HBCUs and PWIs, students of color going to these institutions. The through line is everyone mentioned a professor of color, regardless of which institution. And they're like, they took care of me. So I'm wondering, like, how did you initiate these relationships? Were they they just happened upon you and you were just blessed with these people in your life? How did those happen?
I'm gonna be honest with you, like that was a blessing. You know, Dr. Black, the year I became a freshman was the first year she ran that program, right?
Wow.
And the purpose of the program was, you know, Yale recognized that there weren't a lot of people of color getting through their STEM programs, right? And, you know, instead of just saying, well, you know, we're not recruiting the best people or whatever, they said, well, why is that, right? And, you know, what can we do to change that? Right. And this is, you know, not to say that this is like groundbreaking, but people are doing that now, and they were doing it in 1995, right? Thinking about what are the ways in which we can create a, you know, pipeline of people to get into the pipeline to get to advanced degrees, right? And so they created this program called STAR, right? Science, Technology, Advanced Research, science, technology, and research, right? The STAR program that took students of color who were already interested in careers in the science and technology fields, right? And shepherding them through the process of becoming, you know, either PhDs or MDs, or finishing doing a mechanical engineering degree or anything like that. Because like I said at the beginning, I had no idea what any of this stuff meant. It just sounded good coming out of my mouth, right? And you can get, if you don't have somebody to tell you what the steps are, right? You could get turned around very easily, right? And that was, and again, if you don't have somebody telling you you can do this, right, and it can be done. Again, she was a chemist, right? And she had her PhD in inorganic chemistry, right? So she had done it already. So, and she had started programs like this in other places, but she, they brought her here to do that, brought her to Yale to do that. And so that's how I met her, right? And she was the foundation, I think, of me believing in myself and believing in my talent to do this more so than, a lot of other people. And then as I got older, I found other mentors. And again, they were just placed there, right? Fortuitously for me at the time, for me to take advantage of, right? And I've always been good at having necessary conversations or interesting conversations with people who, not out of a sense of, I'm just trying to pick your brain, but if you have something interesting that I want to know about, right? I've always been I've always had a desire to engage people who have the knowledge that I'm looking for, right? Mm-hmm. So it's good to talk to your peers, but I really always try to engage myself with people who are ahead of me so that I can know what was coming, right? And that's, I think, one of the biggest things you could do is it's good to talk to people who are also going through it at the time, but sometimes all you're going to hear from them is woe is me too. You know what I mean? And sometimes you need to see, well, what's on the other side of this process and how did that person get to the other side of this process? And who better to tell you that than somebody who's already been through that process?
Absolutely. So in those relationships, you've had some great advice and some terrible advice. No disrespect to your mentors, but some people along the way may have been like, just drop out of the program. Like you may have been griping about it. And you're like, yeah, just leave. Like, so what's some terrible advice you've heard along the way that you're like, I'm so glad I didn't follow through with that?
Some terrible advice. Actually, to be honest with you, in some ways, right, the terrible advice I got was from a vascular surgeon, because he told me that I should go spend time in interventional radiology, right, to learn these catheter skills. And that was a good thing at the time, but fairly soon after I decided to go into interventional radiology, right, a lot of these endovascular procedures were exclusively being done, especially with peripheral arterial disease, were exclusively being done by vascular surgeons, right? And so if I really wanted to do endovascular procedures, I should have become a vascular surgeon, because as an interventional radiologist, by the time I was applying for my fellowship, very few people were actually doing any of these cases. And that's part of the reason why I chose University of Michigan, because they still had a lot of peripheral arterial disease as part of their training program. And they still had a very robust vascular relationship with vascular surgery. So we did a lot of endovascular procedures from that regard. But I think had I not followed that advice, I don't think I would actually be as happy, because I like radiology in general. But if I only wanted to do endovascular procedures, I should have probably stuck with vascular surgery.
Okay. Hey, well,
but
it
worked out
doing well now. It worked out. There we go.
Yeah, exactly.
So what, on the flip side, what's some of the best advice you've ever received?
Do what works for you, right? I remember when I was a fellow, right, I had a attending, Jim Shields, who told me, right, the purpose of fellowship is to see a lot of different ways to do things, right? But do what works for you when you get out, right? So one of the things that, when I was a fellow, that they were very big on, because there were a lot older interventional radiologists, is like, you need to, in order to get femoral access, you need to palpate the artery, right? And you need to do it by feel, right? And so a lot of times you miss the vessel, or you'd be kind of off, or you wouldn't be all the way in, and just poke until you got in, right? 3-4 times, right? and I had a couple younger attendees who like, just use ultrasound, right? In ultrasound, you always hit the vessel because you can see it and you can see your needle.
Mm-hmm.
So when I got out, I did what worked for me, which was me being able to see the vessel and see the needle. So that, like, that piece of advice is always helpful. And again, you have certain skill sets, right? And those skill sets are such that you need to play to those skill sets, and do the things that you like to do and do the things that work for you.
Perfect. What would you say is the most challenging part of your job?
The most challenging part of my job actually is, in some ways, is getting people to really truly understand how very important vascular diseases and peripheral arterial diseases in our community and just in general.
Mm-hmm.
Right. The reality situation is that, peripheral arterial disease and diseases associated with it kill more people every year than every other cancer combined except for lung cancer. Right. But the awareness for peripheral arterial disease is not there. Again, because I used to, when I do talks, like to tell people it's the ugly stepchild of coronary artery disease, right? Or the redheaded stepchild of coronary artery disease. If your chest is hurting you, people go to the hospital immediately. But if your foot is killing you, you can't walk, people just assume it's old age, or they'll just put it off. And the sooner you get to somebody to treat that disease, the better off you are, right? And even if the only treatment is to continue to monitor it and make sure it doesn't progress and modify your risk factors to make sure that doesn't happen.
And those risk factors include?
Diabetes, making sure your diabetes is well controlled. If you have diabetes, renal failure, making sure that's also dealt with. Hypercholesterolemia, right? Making sure you're on a statin and also taking some sort of aspirin daily. Those things, are very simple things that you can do, especially except for the diabetes issue, because eating is something everybody has to do, and modifying your diet in order to make sure that your A1C is where it needs to be, and taking your glucose and your insulin appropriately. That's a chore, but it's a chore to everybody that people with diabetes need to do in order to prevent or help mitigate the risk factors for peripheral arterial disease and coronary artery disease, because the same stuff that's going to help you keep your feet on is going to be things that are going to help you stay out of cath lab getting a heart cath. Oh, so yeah, and so like it's like I said, it's because of the rates of diabetes in communities of color, right? It's something that should be probably number one on everybody's list of things they need to concern themselves with, right? And so diabetics who have small foot wounds that don't heal very quickly need to get themselves to a vascular medicine specialist to at least check out why that's not happening. Because if I stub my toe, right, and I get a cut on my toe, it's gone in a week, maybe 2 weeks. If it's not healing, there's something wrong, right? Whether or not I might be able to do something about it is we won't know until we take pictures. But the reality situation is that there's something wrong, and something needs to be further investigated. And I feel like a lot of people wait too long, right, to get the help that they need, until you're at the point where you're, instead of trying to keep your toes on, you're just trying to downstage what level of amputation the person's going to wind up getting, not because you can't get the vessels open, but because the tissue's already dead.
Mm-hmm.
And so the sooner you get to someone that can help you with revascularization, right, the better. And the other thing that I would caution everyone who gets into that position where someone's telling you need the amputation, if they're telling you need the amputation without at least doing an angiogram, something's wrong, right? They should at least check out what the issue is before they start cutting off limbs.
I mean, that's super impactful.
Because your mortality rate goes through the roof if you have a below-knee amputation versus keeping your foot on. And the further up the leg you go, the higher the mortality rate. Your 1 year and 5 year mortality rates go.
Yeah. I also feel like from a human perspective, outside of the clinical aspects, like you losing limbs is super impactful to mental health as well. So that's why everything is super connected, whether it's
Yep.
vascularly or just mentally, how you're affected by losing limbs.
Yeah. I honestly think that's a thing that's, I think, often under not really thought of when people suggest amputations, right? And what that means to that person's life. Because, you know, when you think back on your life, you've been independent for quite some time. Most people, not relying on people to move around, right? Not relying on anyone to go to the bathroom, go cook dinner, go drive a car, right? And losing a limb for some people greatly impacts their ability to do that.
Yeah.
And the psychological ramifications of having lost a limb is frequently underestimated by the people taking the limbs, right? They just look at a piece of tissue and say, okay, I need to save this person, which is the right thing to do. But the reality of the situation is you need to also consider what that change in their lifestyle is going to be.
Absolutely.
Because, you know, you could take somebody who was previously independent, but you put them in, you know, you do an above knee amputation on them, and now they're in rehab or in a nursing home for the rest of their lives. And that, in some ways, is devastating, because I feel like, not to say that every amputation is preventable, but the vast majority of them are.
And that's by and large what the work at Modern Vascular is dedicated to. So it's super important. Very happy to highlight that this month. So what would you say, and that might just feed right into it, would be the most rewarding part of your work?
When someone comes back to me and says, you know, I was in pain all the time, and you did this procedure or 2 or 3 procedures on me, depending on the amount of disease you have, and now that pain's gone. Or I thought I was going to lose my leg, right? And now, you know, I can go out and hang out with my grandchildren or my great grandchildren in some instances, right? Those are the things that, you know, motivate me more than anything else, really.
Beautiful. All right, we're gonna still keep it a little lighthearted. Let's get into less heavy subjects. What, outside of your actual like work as a physician, what brings you joy?
Okay, so I definitely like my children bring me joy. My wife, my kids. I have lots of hobbies. I was a huge nerd as a kid, and I'm actually quite happy that nerd culture has become dominant culture. So like I read
It's
every
in vogue
X-Men
now.
comic book. Huh?
It's in vogue now. Everybody's
Exactly.
a nerd.
You know, but I read every X-Men comic book. I know exactly what's about to happen in the multitude of madness,
Hold
the
up,
multiverse of
X-Men.
madness.
Who is your character? Who's your favorite
Oh,
character?
Storm. Storm was
Absolute.
that was
There we
my
go. That's
girl.
it.
That was my homegirl. And then Bishop was a close second. That was my man.
Come on, representation. I know both of those
Exactly.
because that's who I took to as soon as I
Yeah,
was watching.
exactly.
It's like, yep, those are my people. Whether they were bad guys or not, I'm still gonna rock with them.
Yeah. Bishop was just misunderstood.
There we
He had
go.
you know, he knew what was going to happen if everything, if certain things didn't occur correctly or continue to occur.
There we go. There we go.
And then so that's, you know, and I still read comic books now. Like when I got my kids hooked on them. Of course, they read manga now, but whatever, it's still they're reading. So I'll you know, because I mean, again, I wasn't always the best student, but I like to read, right? And one of the things I like to read was comic books. And so that actually gave me, you know, a foundation and just straight up imagination, you know, and thinking outside of the box and thinking, you know, what could the future look like? And then one of the other things I'm big on is actually I love to barbecue. I actually used to Used to, I say used to because I'm moving now, but I had a barbecue business that I did
Oh, wow.
catering and ran a food truck. Yeah. So, I cooked whole hogs because it's kind of like a family thing that I learned how to do. And I actually went to a couple of barbecue schools. And, to be honest with you, my motto is there's two things you don't have to do, ask me twice to do, which is one is cook a pig and the other one is recant tibial arteries. Those are two things you never have to ask me twice to do because I'm on board the first time you ask me.
You know what? This is why I
Um,
ask these questions because,
mhm.
okay, doctor, all right, yeah, okay, all right. Not to minimize that, but nobody's worried about the barbecue and the whole hog that you So, no, this is a beautiful moment. You're a whole
Yeah,
person. You're not just a
yeah.
physician.
Hmm.
One thing that you mentioned earlier and just reiterated about not being like the best student, I really want to drive that point home to students that are, they might want to be a doctor, but they think it might be too hard, or it's like, okay, well, I wasn't the best student, so it's obviously not for me, or Ivy League is not for me because I'm not as excellent as my idea of what the excellent is. Whereas you're like, it took me a process to get there. And I eventually started caring more as I got closer to what I
Hmm.
wanted to do. And along the way, there were different directions where I was like, okay, I'm not interested in that specific specialty. So I'm
Hmm.
going to go a different route. Like, people need to know, like, you don't just make one decision and like, that's it. That's all.
Hmm.
Like, it's done. You have 10 years stuck on the same route and you're stuck. Super important to let people know about.
Yeah, I mean, to me, I think the biggest thing is that you can, and I told, I ran a mentoring program in New Haven when I was a medical student. So, focused on gifted students of color. But the main thing I would always tell them when they ask me, how do you become a doctor? I'm like, man, if you can read and write, you can do this. Right. And you can't, I liken it a lot of times to how you look at, lifting weights to some extent. Right. If somebody tells you how much weight is on the bar, right, you can psych yourself out about not being able to lift it,
Mhm.
right? But if you just sit down, don't actually look at the plates and start pushing, a lot of times you can get that up. And it's the same way, right? If somebody tells you how hard it is, you actually start to believe them. But if somebody tells you it's not that hard, then you start to believe them too, right? And there's going to be a lot of people who's going to want to tell you that it's too hard for you, right? And some of that is their own personal fear. And you got to act, and anytime somebody says something like that to you, you have to analyze why that person may have said that and where they're coming from, right? And understand that people say things to you that don't have your best interest in heart, and they're not going to be malicious about it, but there's a certain level of fear that they have. You have to have a certain level of irrational confidence, but the reality situation is you can turn yourself into anything you want to be, right? And as you said, you just honestly, if you believe it, you can do it. And that sounds corny, but it's the honest goodness truth. And there's a
I,
lot of work that goes involved in that,
I want to
but
call you
it's
pastor right
possible.
now. I almost said preacher. I'm not Kirk Franklin, but you're about to get me
But
to
it's
jump
true,
out.
man. Like people become
Yes,
the thing. Like, why do you think that?
yes.
Why do you think that every kid dribbling a basketball thinks they can become an NBA superstar? Because who is in the NBA, right? If every physician looked like me, guess what? Everybody in the hood would be like, I'm gonna become a doctor because all doctors look like me,
Yeah,
right? People become what they see,
yeah. Which is
right?
why
And
it's
that's
so
just the truth.
important for me, the representation and exposure and making sure people
Mm-hmm.
know that it is possible, it is being done, has been done for years. I just need to show them that it's happening
Right.
if they are not yet exposed to, because
Mm-hmm.
we are excellent in so many facets. Everything under the sun that can be done, we do it well.
Yeah.
So I just need to show everyone that we've been doing it. So
And again, like I tell people all the time, like there was a time when people didn't think Black people could play the role of point guard on a basketball court. Think how ridiculous that thought process is right now.
Yeah.
But back then, they would tell you can't play point guard because you know that's not what y'all do.
Oh my gosh.
And again, when people tell you things, you need to know where it's coming from.
Yeah. Absolutely. All right. Now, what is your idea, or like, what does success mean to you?
In all honesty, success, it means happiness, right? In my mind. That's what success is. And whatever form happiness takes for you, I think creates success. For me personally, right? It's being fulfilled both professionally and socially, right? Being able to have that release and, you know, have fun with people that I care about, right? Both in my family and outside of my family, but also still be able to apply the same amount of joy coming to work. Like, you know, when I get through a vessel, right, you know, and people are going to find out this about me, but I do a dance, right? I do a little dance because that makes me happy. Like when I come in and have 3 or 4 good arterial cases on the schedule, right? That makes me happy, right? My whole week is set. So that's another reason why, you know, I wanted to move to a place where I could actually do more of the cases that I like to do, because I, you know, realize that it changes my perspective on so many other aspects of my life when I'm actually able to do these cases and do them well.
That's beautiful. I'm not gonna have you guys have me crying on this episode, so we're going to segue into our final line of questioning. Are you ready for our Q&A?
Yeah. Okay.
All right. That was beautiful.
I'll plead the fifth where necessary.
Okay. He already knows about these questions. Okay, so who is your biggest inspiration?
Who's my biggest inspiration? Actually, you know, to be honest with you, my son. Right? Because I had him when I was a third year in residency. And there were so many times before that where that whole, oh, I'm just going to quit and go down and work for Lehman Brothers concept came in my mind. Not Lehman Brothers, whoever, like Goldman Sachs. That was a big high banking firm. And I have friends who worked over there. Right? But, you know, I started to do a lot. When he came around, my son Tyler, when he came around, I started to do a lot more because I had to do it for him. Right. And then, you know, I'm going to tell you a story. It's going to sound stupid, but, you know, he was like maybe 5 or 6. Right. And, you know, he wasn't the biggest kid. He wasn't the, you know, fastest, but, you know, he said, I want to do wrestling. So, and I wrestled in high school. So, you know, I took him, we did a wrestling. He did one wrestling tournament. Right. And the kid was better than him. He was 3 years older than him and bigger than him and stronger than him and knew how to wrestle. Right. We pinned him real quick. Right. And the guy, you know, the referee said, hey, do you want to come back out? Right. And I asked him, I said, hey, you know, you don't have to go out there and do it. He's like, no, I want to do it. I want to go back out there. Right. And that, like I said, is that, you know, he didn't win. Right. But that desire, right, was so inspiring to me. Right. Because even if you know you up against it, right, you still got to try.
Absolutely.
So that's, and my daughter, she inspires me. She inspires me. Like, and they, you know, they're in a lot of ways better people than I was when I was their age. So that's, you know, they're inspiring me. My
Shout
daughter,
out to the next generation.
A trip. And like, you know, again, people become what they see. She wants to become a dermatologist because she doesn't really know that, you know, I could tell her the steps to get there, but, you know, she, you know, has a desire, a vision this early about exactly what she wants to do. And that's inspiring to me as well.
Awesome. All right. So who do you hope to uplift with your work?
You know, I hope to uplift my entire community, be that no matter where I am, right? Whether that's in, Louisville, Kentucky, or Dallas, Fort Worth, hopefully. And then I also want to be able to give back to people in Brooklyn, because I'm always going to be a New Yorker. No matter where I live, I'm going to be a New Yorker, which actually made it easy for me to leave because I was like, I'm always going to be a New Yorker.
Take it with you.
Right. So the cachet of living in Manhattan is like lost on me.
Okay.
Right. And those are the people that I feel like I want to inspire as much as humanly possible. But hopefully, I get to a point that I'm able to teach. Right. And teach primarily people of color, because that's what I think that's where my value is going to be. Right. Becoming a role model just by simply being in those spaces for people who look like me, because I didn't necessarily have that. Right. Especially in radiology. And there's even more, especially in interventional radiology. There are so few Black interventional radiologists, it's ridiculous. I think I met all of them when I was interviewing for fellowship.
It's so important for me, whether it's a door or knocking down a wall, to bring in people with me. So I so support that. Any way we can collaborate in that.
No, definitely. I'm not joking.
Available.
I want to keep in contact with you, because anytime you want somebody to speak, talk, even play, basketball for a charity, I'm down.
Okay, the wheels are turning. All right. Last but not least, how do you stay engaged with your motivation? So what keeps you going?
So part of the reason why, I like peripheral arterial disease is it can be frustrating, and things that frustrate me motivate me, right? And I get bored when things become easy, right? And even though peripheral arterial disease and treating these patients is something I love to do, right? It's never really easy, right? Especially some of the cases that you get, right? There's always a challenge in every particular person, right? And, especially because of the rates of diabetes, the vessels are very brittle. They're chronically occluded. Many of them have very poor runoff and all those kinds of things. And figuring out how to maximize those very dire situations, right? Like keeps me engaged. So I'm always reading, I'm always listening, because like I want to learn more, right? I want to get better. I want to get faster. I'm constantly learning what's the newest technique and how can I apply that to these patients, right? And how can I think outside the box to help them too, right? What techniques can I come up with and ways in which I can help, do things and teach people how to do things so that we can help these push this space forward and help these patients better. Because like when I came out of my fellowship, tibial arterial recon was just not really something people did, right? You might do an angioplasty on an artery that was narrowed, but you weren't trying to do long segment recanalizations. And then people started sticking, pedal arteries and digital arteries and going back the opposite way, and realizing that the mechanics of this is, antegrade and retrograde access is often necessary, and it changed the game. Right. But again, that's pushing the envelope forward. And that is those challenges are what motivate me and keep me engaged, because that is something that is always going to be, and there's always a better way to do something. And I'm always looking for the better way to do something.
Well, you know what, Dr. Jean-Baptiste, thank you so much for joining us. This has been
You're
an
welcome.
incredible conversation.
Thanks for having me.
I actually didn't want it to end, but you're a very busy person. I want to respect your
I
schedule.
understand.
How would you like people to stay in contact with you? How can those med students, those students that are in high school that are looking to get into what you are into?
So you can email me at Ryan, RYANS as in Sam, Jean-Baptiste, JEAN, B as in boy, A, P as in Peter, T as in Thomas, I, S as in Sam, T as in Thomas, E as in Eric, at gmail.com anytime. I will fully embrace my old personness and tell you that I am not the most active person on social media. You can try and find me on Facebook, but that's about as far as it goes. I have an Instagram account, but I can't even remember what the heck my handle is. And I don't Snapchat or whatever, TikTok or all that other stuff. I don't do that stuff. But I am probably, once I get into Modern Vascular, I want to work on becoming better at that and probably start my own YouTube channel of cool cases, hopefully.
Super excited for that. Well, everyone, September is PAD Awareness Month, so this is just our small way of spreading the awareness and making sure that all of those things, those risk factors that were mentioned, that you keep mindful of, and that you go ahead.
No, I want to reiterate, if you're a diabetic, right, every time you go to a doctor, somebody should be checking your feet. You should be checking your feet every day to make sure you don't have any sores that are not looking good, right? And if you are having sores that aren't looking good, skip over the family practice physician and go to a podiatrist, because a podiatrist is most likely going to be able to refer you to a vascular medicine specialist if the wound isn't healing, right? And the sooner you get to somebody who can actually help you open up the arteries that go down there, the better off you are. I cannot stress that more than anything else.
That's it. That's all. We're saving limbs and lives. So everyone, again, I am Sammy Ashe. Thank you for checking out another episode of the Inspire, Uplift, Engage podcast. Take care.
Thank you. All right. Take care.
Thank you.